السلام عليكم الطلاب المرحلة الرابعة في كلية طب الاسنان. معكم المدرسة الدكتورة افراح دكتورة في امراض الفم والوجه والفكين من فرع التشخيص الفمي. واليوم موضوع محاضرتنا على الاميون mediated and vesiclobullous disease. Many diseases target the surface epithelium that characterized by substantial increase in the number of Langerhans cells that play a initiator of cascade of cellular and systemic humoral immune response against the normal mucosal and skin epithelium. هنا راح يصير عندنا في الكاسكيد اللي هي مجموعة من الاميون سيستم راح تهاجم لنا الميوكوزال and skin epithelium، واللي هي جاية بسبب ان اللانجرهانز سيل موجودة حيصير بها اكتيفيشن بعدة اسباب مختلفة. الأفلس ستوماتيتس أو حيسموها recurrent أفلس ستوماتيتس أو عندنا الكانكر سورس. That is the most common disease that affected the oral mucosa that may confused with the recurrent herpes simplex infection. Recurrent أفلس stomatitis occurs in the distinct clinical form, three types of distinct clinical forms: أفلس minor, أفلس major, and herpetiform ulcers. Minor أفلس minor characterized by small, round, painful, superficial, hollow ulcers with whitish yellow base and have sharp edge with erythematous hollows. Mostly it is found باللب بالبوكال ميوكوزا، ممكن نشوفها على الفيستيبيول. راح تصير موجودة بالنون كيراتينايز ميوكوزا بالفنترال باللاترال surface of the tongue بالانتيريور floor of the mouth, lasting from 10 to 2 weeks, and then diagnosed by clinical signs and by symptoms. Microscope examination لها راح تصير non specific، فمعظم الأحيان حنسوي لها diagnosis عن طريق clinical signs and symptoms. أفلس major ممكن نشوف 1 or 2 ulcers. It is uncommon ulcer, large ulcer with the superficial painful ulcer usually appear on the labial mucosa وبالsoft palate مثل ما نشوف الصورة. النوع الثالث هو الهيربتيفورم ulcer اللي هو rare. راح نشوف عندنا multiple small diffuse painful superficial ulcer with episodes of long duration. ممكن occur in the both glands bearing keratinized mucosa and non-gland bearing. Recurrent aflus stomatitis also occur in association with chronic gastrointestinal disturbances. ممكن راح تصير بالmal absorption syndromes، ممكن نشوفها بالبهجة disease، ممكن تصير associated with asthma, HIV infection, ingestion of certain food such as nuts and chocolate, menstrual cycle, period of stress and anxiety, and also family history of the lesions. The treatment, there is no treatment exists for the aflus ulcer. The treatment is also for prevent the predisposition for this ulcer for attack, for future attack. The treatment by direct with the reduction of intensity and length of the episode of the lesion by putting gel cream of topical steroid on the lesion, and the management usually require combination of use of short systemic or topical steroid. Antimicrobial rinses may be required for reduce or prevent secondary infection. Behçet syndrome or Behçet disease. It is a multi-system disease that characterized by formation of aflus ulcer. One of the components of Behçet disease is the aflus ulcer. The pathogenesis is uncertain of the Behçet syndrome and consists of multiple oral and orogenital and ocular aflus-like ulcer or lesion there is associated with arthralgia and central nervous system involvement. مثل ما نشوف هنا راح نشوف عندنا lesion ocular involvement and this is a picture of the beheaded doctor that discovered this lesion. Circulating autoantibodies to the mucous membrane are found. Young adult men have severely affected than women. Pathology test راح نصير نقدر نميزها عن طريق الباثولوجي تيست هذا الديزيز اللي هي حصير عبارة عن intense inflammatory reaction to intradermal injection for a small amount of saline may be useful in diagnostic aid. راح أسوي injected small amount of saline into the skin وراح أشوف بعدين formation of inflammatory reaction intradermal intradermal injection there will be reaction. The histopathology of this lesion is ulcerated lesion similar to those of aphthous ulcer and there will be severe vasculitis. The treatment is by topical and systemic steroid, prevent serious ocular damage and use of azathioprine and to show effectively for long and aid for long term for prognosis. Lichen planus. It is a skin lesion that is common within the oral cavity, where it appears as either white reticular or black or erosive lesion with a prominent T lymphocyte response in immediate underlying connective tissue. It occurs in both cutaneous and oral surfaces. Cutaneous lichen planus may be mild clinical course and resolve within 2 years, while oral lichen planus tend to follow a more chronic course. Reticular, atrophic, hyperplastic, and erosive forms are well recognized. More than one clinical subtype ممكن نشوفها at the same time. The causative factor that initiate lichen planus are still unknown, but are thought to be an external antigen that penetrate the superficial cells to stimulate the intraepithelial dendritic Langerhans cell to stimulate CD4 and CD8 lymphocyte toward the basement membrane attack. Reticular type, it's white line, net, or reticular appearance against the erythematous background اللي احنا راح نسميها وجهم سترايين. Usually it is bilateral and occurs most commonly on the buccal mucosa, buccal vestibule, tongue, gingiva, and may be sensitive if become atrophic or erosive. Erosive lichen planus have a mixture of erythematous, erosive and white pseudomembranous area with fainted white radiating striation. يعني الستريشن هنا أقل شوية يبين من الأول. The patient complain of sore mouth that is sensitive to hot, cold, temperature, spicy food, alcoholic beverage, and during examination of lichen planus, touching the area produce pain and bleeding. Correct diagnosis made by biopsy of the perilesional tissue. Erosive lichen planus, difficult to differentiate from the candidiasis. Mucous membrane pemphigoid, pemphigus vulgaris, discodlobus erythematosus. Other prolonged involvement with erosive lichen planus راح يؤدينا إلى حدوث hyperpigmentation, melanosis, will occasionally occur when the mucosa in healed area. يعني المكان اللي يصير بيه lichen planus راح يصير بيه healed وبعدين يريد يطلع وبعدين يصير healed هو chronic هنا بهالحالة فراح يصير بيها hyperpigmentation نشوف أكثر بيها melanosis. Black lichen planus appear as a white, raised or flattened area indistinguished from the other focal leukoplakia. The most common location is the dorsal surface of the tongue. The diagnosis of the reticular lichen planus is present with the characterized with striation. The erosive and black foam require incisional biopsy and direct immunofluorescent examination because clinically can resemble number of other mucosal lesions including malignancy. فمن هنا راح نشوف الاميونوفلورسنت راح تصير directed antigen antibody against the mucous membrane. In histopathology, there is thick layer of orthokeratinized or parakeratinized mucosa that cover thickened spinal cell layer acanthosis. راح نشوف بيها shortened and pointed sawtooth appearance اللي هي retiridge, and there is a thickness area C اللي هو حاصل هاي thickness area اللي راح نشوفها احنا بالكلينيك هي اللوكام سترايشن. اكو area راح يصير بيها atrophied epithelium اللي راح نشوفها بالكلينيك as red area اللي راح يصير بيها loose of retiridge formation. الconnective tissue راح يصير there is dense accumulation of T lymphocyte against the basement membrane of the epithelium. The treatment, most clinicians do not think there is necessary to treat a small area of reticular or black type of lichen planus unless it becomes symptomatic or persists or widespread. The more severe form of lichen planus, erosive lichen planus, does need to be treated, usually by a response of topical or systemic steroid or both. Lignoid reactions. New medications have a greater tendency to produce lignoid reactions as a side effect in individuals who are susceptible or born to this condition. The histological and immunological finding is similar to the lichen planus. Antibodies and antihypertensive and gold compound, diuretic, antimalarial and non-steroidal anti-inflammatory medication كلهن هذني ممكن نشوف بيها side effect بالsusceptible patient راح يظهر على شكل lignoid reaction. التريتمنت راح نعطيه topical أو systemic steroid وستوب or cassation للميديكيشن اللي راح ياخذه. هنا بهذا البيكتشر راح بس فقط اميز between physical and bullous. الفيزيكال and bullous مثل ما نشوف الفيزيكال هو small يعني هي physical راح نشوف عندنا الكافيتي هنا عندنا epithelial cell راح تصير على شكل فد بالون degeneration بيها بداخلها lysis of epithelial cell او تجمع من الفلويد راح يصير بيها inside the epithelium. الفيزيكال يصير اصغر من البولاي. حتى اكمل المحاضرة تفهمون الفرق between the physical and bullous. Mucous membrane pemphigoid. It is autoimmune desquamating or blistering disease of a mucosa resulting of epithelial separation. It takes place at the level of the basement membrane and commonly affect the gingiva before extended to the other mucosal lesion. There is disruption involved component of the hemidesmosome that link the cytoskeleton of the epithelial basal cell to structure within the underlying connective tissue. مثل ما نشوف الصورة شلون راح يصير completely separation of the epithelial cell from the underlying connective tissue. Three similar disease processes have been associated with the destruction of encouraging fibrils of the mucous membrane اللي هو الميوكس membrane pemphigoid والscistotritial pemphigoid والbullous pemphigoid. Chronic lesions confined to the oral mucosa membrane are referred to as having oral mucous membrane pemphigoid. Other with eye lesions with tendency for scarring having scistotritial pemphigoid, and those patients with one or more bullous lesion on the skin راح نسميهم هنا الbullous pemphigoid. When it is restricted to the gingiva only راح نسميها هنا desquamated gingivitis. It is a clinical test for wrapping or pushing on the tissue. هنا راح نستخدم النيكولسكي sign. النيكولسكي sign هي clinical test راح يصير عندنا wrapping or pushing the tissue with a blunt instrument or gauze. فهنا راح يصير formation of a blister next to 1 to 2 minutes اللي هو هاي specific for mucous membrane pemphigoid, not specific for mucous membrane pemphigoid. ممكن another immunological disease هم يصير عندنا positive Nikolsky sign. Ocular mucous membrane pemphigoid appear as conjunctival erosion, scarring, and serious loss of vision ممكن يصير as a complication of ocular mucous membrane pemphigoid. الdiagnosis راح يتم عن طريق اللايت مايكروسكوب and direct immunofluorescent technique, and it is necessary to separate the mucous membrane pemphigoid from all other disease with positive Nikolsky sign. The histopathology is found a separation, show the separation of thickened epithelia within the basement membrane from the connective tissue. Leave the connective tissue with diffuse infiltrated lymphocyte, plasma cell, and occasionally eosinophil. The treatment is by combination of systemic and topical steroid. There is necessity for treatment of eye lesion. There is serious eye lesion, esophageal or laryngeal affliction with prolonged steroid, cyclophosphamide, and azathioprine therapy. Pemphigus vulgaris. It is a desegmented dermatological disease caused by autoantibodies attack the desmosome, autoantibody to desmoglin 3 of the intercellular cohesive system between the cell located in the basal cell layer, resulting in suprabasilar bullous formation, acanthosis. مثل ما نشوف هنا بالصورة. الصورة الأولى اللي هي هنا راح يصير bullous pemphigoid اللي هو completely separation of epithelium with the basement with the basal cell. هنا البنفقس vulgaris لا، راح يصير هنا البازل سيل راح تبقى ملتصقة بالبيزمنت membrane، وراح يصير اللاكسس of the cell above the basal cell area. البنفقس vulgaris can be serious life-threatening disease. Mortality rate marked between 16 and 19%. Aggressive immune suppression treatment with treatment لازم يحتاج البيشنت. Patient death rate about 5%. Mortality is due to mostly a combination of advanced age with infection and other complication. فيحتاج high dose of steroid for treatment. A clinical feature, pemphigus vulgaris mostly prevalent in all patients. فوق 40 سنة 40 ل 16 years old. The fact that the certain ethnic group are more born for development of pemphigus vulgaris. فحيطلع لنا هنا theory that have genetic predisposition. Pemphigus vulgaris develop in association with drugs مثل penicillin, rifampin, penicillamine, and there is a paraneoplastic pemphigus vulgaris, and non-Hodgkin lymphoma, leukemia, and some other spindle cell tumors. هذني لها predisposition for formation of pemphigus vulgaris. Oral pemphigus vulgaris precede the presence of skin lesion, often about 1 year earlier. Bulli are commonly present on the skin, but are rare found in the oral mucosa, soft palate, gingiva, or the tongue. It is the most common site for the development of pemphigus vulgaris. There is delicate surface layer of the lesion that quickly lost, leaving a erythematous area with that have sensitive to hot, cold temperature, spicy food, and alcoholic beverage. Both skin and the mucosal tissue will have positive Nikolsky sign. مثل الميوكوس membrane pemphigoid, البنفقس vulgaris أيضا have positive Nikolsky sign. The histopathology of the pemphigus vulgaris show normal thickened of epithelium with normal rete formation. Mild inflammation is found in the connective tissue, underlying connective tissue. The basal cell is intact, but the cell of the suprabasal layer have separated. There is acantholysis of the suprabasal cell and floated freely in the fluid-filled intraepithelial space. These cells that float freely have a polygonal shape and become rounded and less cytoplasm visible around the nucleus. This gives the cell malignant appearance when viewed in cytological slide, termed Zank cell, and it is characteristic finding in the fluid area of the epithelial separation in the pemphigus vulgaris. ممكن نشوفها كذلك الزانك سيل بحالة chicken box، ممكن نشوفها بالهربس سمبلكس بالهربس زوستر انفكشن. مثل ما نشوف هنا هاي السيلز اللي هي المؤشرة بالارو، it is a zank cell. The treatment: it is an aggressive disease, require prolonged high dose of prednisolone, range between 150 to 360 milligram daily for about 6 to 10 weeks. Because the side effect of prolonged high doses of steroid can be severe, doses are often reduced after initial period and used in combination with other non-steroidal immunosuppression drugs such as azathioprine. Epidermolysis bullosa. It is another immunological disease that characterized by separation of the epithelia from the connective tissue, with the formation of the large blisters around the extensive scar formation. Intraoral blisters scarring diminish the oral opening, leading to deterioration of oral hygiene, high caries incidence, and periodontal disease. The epidermolysis bullosa treatment is non-specific. It is require maintenance of the patient nutritional status and require نحاول انه restricted oral opening and esophagus restriction، لازم نسوي لها correction حتى يقدر البيشنت normal nutrition انه هو دا يفقد سوائل من السكين مالته والميكوزا الممبرين، فيحتاج دائما تعويض. Arrhythmia multiforme. It is another inflammatory disease of immune origin that affect the skin and the mucous membrane with wide spectrum of manifestation. They will be vary according to severity matter. It is commonly precipitated factor infectious، ممكن infection predispositing factor للاريثيما multiforme مثل herpes simplex virus infection، mycoplasma pneumonia and histoplasmosis. drugs ممكن يصير predisposing factor إليه مثل drugs with sulfate، penicillin، dilantin، barbiturates، iodine and salicylate، and some gastrointestinal condition مثل Crohn's disease and ulcerative colitis, and other conditions such as malignancy, radiation therapy, and recent vaccination. Erythema multiforme pathogenesis matter is unknown. Research identified circulating immune-related complex, encountered some infections and medications. Epithelial and blood vessels are the target of this disease, resulting in vasculitis, ischemic necrosis, and subsequent skin and mucosal erythema that progress into the necrosis and sloughing of the epithelial layer. Clinically, there will be minor and major erythema multiforme. Usually, the acute form of erythema multiforme is called Stevens-Johnson syndrome, and also called another manifestation is toxic epidermal necrolysis. This form of severe erythema multiforme of major is associated with high mortality rate and both characterized by large blister formation and sloughing of epiderm. مثل ما نشوف الصور انه حيصير في extensive severe form of erythema multiforme اللي هو بحالة ستيفن جونسون syndrome وبحالة عندنا التوكسيك epidermal necrolysis وهحتاج عندنا هنا تريتمنت سبلمنت هنا النيوتريشن انه حيفقد هواية من السوائل من البلسترز. Before the appearance of the lesion, 3 to 7 days, there will be severe headache, fever, malaise occur. There will be focal diffuse area of arrhythmia, target أو حيسموها البولز آي أو iris lesion مثل ما نشوف بالصورة اللي هي راح تصير concentric erythromatous patch that contain peripheral thin zone of pallor and surrounded by one or more of erythromatous ring. There will be positive Mikulski sign in patient of arrhythmia multiforme, and the oral lesion are painful, formation of eye lesion that lead to scarring and partial blindness. The histopathology of the tissue from that come from arrhythmia multiforme are variable. Immunofluorescence testing with a clinical finding are considerable diagnosis with a patient with arrhythmia multiforme. Treatment of this disease in mild cases are symptomatic and consist of antihistamine, analgesic, and antibiotic combined with the oral rinses of antihistamine and use of topical steroid. In severe cases of high risk of infection and mortality rate, so it is required for hospitalization. Lobus erythematosus. It is a chronic inflammatory condition of the skin and the connective tissue and internal organs associated with circulating autoantibodies to the DNA and RNA protein. The circulating antibody they may be appear as a circular whitish mucosal lesion with erythematous rash or on the sun-exposed skin are common. It is characterized by butterfly appearance in this lesion. So we have mucopapular rash on the as a butterfly appearance on the skin of the face. Females are suspected more than male, about 9 to 1%. The pathogenesis of this disease is still not fully understood. Combination of genetic, environmental, viral infection, exposure to ultraviolet light and drug and hormonal factors كلها راح تلعب لنا دور بالformation of this disease. The evidence show there is immune system become altered and responsible for deleterious change that take place within the basal cell and the basement membrane and collagen and vascular tissue. Autoantibody to the nuclear DNA, anti-nuclear antibodies, and ribonuclear protein antigen and cytoplasmic and systemic surface present in the blood واللي هي من عندها ممكن نسوي diagnostic aid this disease, lobus erythematosus. It occurs in 3 clinical forms. Present راح تختلف بالseverity والdistribution. أول شيء هي discoid lobus erythematosus اللي هو mild form and it is chronically and confined to the sun-exposed skin of the face, skull, and ears, but also involve oral mucosa. Subacute cutaneous lobus erythematosus. It is the intermediate form and it is more widespread and affect head and neck region, upper tongue, extensor surfaces of the arms. Symptoms of the muscles and joint stiffness, malaise and fatigue are common in this lesion. النوع الثالث اللي هو systemic lobus erythematosus اللي هو most severe form and the most common form primarily involve the organs, especially kidneys. Most of the systemic problems are related to the kidney. There will be severe damage to the glomeruli, arthritis, arthralgia, heart and lung involvement, bone marrow depression, anemia راح نشوف بيها, lung involvement, diffuse vasculitis and skin rash اللي هو راح نسميها butterfly rash over the malar area of the face. Clinical feature of the oral mucosa can be found in lobus erythematosus راح تبين لنا على شكل leukoplakia with erythematous erosion or chronic ulceration ممكن تظهر لنا. المايلد form appear as an area of chronic erythemia اللي حصل sensitive والها burning sensation. long standing of this lesion اللي حيصير عنده hypopigmentation and atrophic area with raised border or may be present for years. The histopathology of the target antigen appear to be in the basal and the parabasal layer of the epithelium. The large number of T lymphocytes accumulate and increase in the thickness of the basement membrane of the epithelial atrophied with the loss of leakage. The lymphocytes are concentrated in the underlying lamina propria, and perivascular infiltration of lymphocyte is helpful in differentiating of lobus erythematosus from those of lichen planus. In addition to the presence of the surface depression اللي هو containing keratin bulging suggests that the lesion is lobus erythematosus rather than lichen planus. مثل ما بنشوف هنا بالصورة هذا الليشن هنا هي لللوبس erythematosus differ from the lichen planus. Treatment. Cutaneous lesion of discoid lobus erythematosus are treated with topical steroid. More severe form راح يحتاج عندنا require combination of steroid systemic and local and immune suppressed drugs مثل عندنا cyclophosphamide and azathioprine. Progressive systemic sclerosis لها اسم ثاني اللي هو scleroderma إذا كان generalized أو إذا crushed syndrome إذا كان localized form. يعني أكو localized form أكو generalized form. The pathogenesis of systemic sclerosis is not completely known. The disease primarily affects females, middle-aged women. There will be progressive fibrous replacement in normal connective tissue and with dense back collagen bundle. The skin راح يصير هنا lose its elasticity و softness مالته and become tight and firmly adhere to the underlying connective tissue and bone. There will be a removal of the connective tissue, resulting in a progressive loss of mobility of the hand. The mobility of the hand راح تقل, joint and other moving internal and external anatomic structures. The major oral problem is the progressive restriction in the oral opening and the TMJ complication. Xerostomia راح يصير بيها and associated complication, dysphagia and advanced periodontitis. The histopathology of the tissue that reveal diffused deposit of hyalinized collagen replace the normal anatomic structure. فالسكن راح يصير بيها السويت gland, الhair follicle والspecies gland والadipose tissue حيصير بيها lost and replaced by hyalinization and collagen bundles, والابثيليا حيصير بيه thin. الhyalinization راح يزداد around the blood vessels with a gradual decrease in the number of small blood vessels and stimulants increase in the density of collagen. مثل ما نشوف هنا بالصورة إنه راح يصير restricted للmouth opening and السكين راح يلوز elasticity مالته وراح يصير عندنا thin بالابثيليا بس راح يصير عندنا بمكانه راح يصير عندنا deposition of collagen bundle اللي هي attached للبون firmly attached to the bone. Treatment. In some patients there is spontaneous remission, but other have systemic steroid يحتاج له حتى يعني help in reducing the progression of the disease. In general, no treatment is available لحد الآن to completely heal this disease process. Allergic reaction. Occurs after repeated exposure or contact to the external antigen in previously sensitized individual as immune response mediated by IgE اللي هي that stimulated basophil and mast cell. عندنا مثل عندنا الكونتاكت ستوماتيتس اللي هو الكلينيكال فيتشر مالته راح يصير عندنا arrhythmia, edema, burning sensation, الhistopathology of the epithelium exhibit intracellular and intercellular edema, spongiosis, and the connective tissue exhibit dilated blood vessels against the background of edema and infiltration of plasma cell and lymphocyte. The other type is the angioedema اللي هو راح يتميز بوجود regional and painless swelling of the lip and the anterior cheek, the tongue, upon cassation of the contact والallergen والswelling will subside rapidly of its own. About 24 ساعة لحد 48 ساعة حيصير remove. There is two basic forms of angioedema, type 1 acquired and type 2 hereditary. Thank you for giving me your attention أعزائي طلبة المرحلة الرابعة، وإن شاء الله ألتقيكم بمحاضرة جديدة في مادة أمراض الفم.